Hi, I'm Sean with CPR Florida. Everyone always asks us about regular human CPR. Today we're doing pet CPR, so let's show you some quick tips. Come on inside. Here we are in one of our classrooms. This is our West Palm Beach office. We have 5 other locations. We usually have a lot of the adults and infants set up. But right now we're doing the pets, so I have some of the different mannequins that we use. Here, of course, is one of the adult mannequins that we use in class for the lay people and also BLS. Just like for pet, we would do 30 and 2. So we would do 30 compressions. If you're a healthcare provider, you would check for a pulse. But for lay people, we wouldn't check for a pulse anymore. You go right to compressions, basically center of the chest or lower half of the sternum. And push hard and fast 30 times. 1 and 2 and 3 and 4 and 5 and 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 21, 22, 5, 26, 7, 28, 29, 30. After you do that, if we're going to get breaths, we use a carrier device, or we get mouth to mouth, tilt the head, pitch nose, give 2 1-second breaths. Breathe. Breathe again. Go right back to 30 compressions. Don't stop this until the AED is ready to shock, either come alive or advanced help arrives. So if we were doing pet CPR, we would assess, make sure the seat is safe, and then come up, we'd be tapping, hitting the floor also. For a dog, we have to be careful, so we would come up like this, and then run our hand like here to make sure. If we know that there's no response, no signs of life, we're going to give him some CPR. We're going to start with 30 compressions and then give 2 breaths. So when we do this, we can do 2-handed or 1-handed. We'll have it's a medium-sized dog, so we'll do 30 compressions. And we're going to go nice and hard. You would feel for the elbow lands, like this. And start pushing. We'll pretend it's right about here. Give 30 hard and fast compressions. 1 and 2 and 3 and 4 and 5 and 6, 7 and 8 and 9 and 10, 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now if we're going to give breaths, you go up to here, pull the tongue out a little bit, and give mouth to snout. So we're going to give 2 breaths. Breathe. Breathe again. Looking for the chest to go up and down. Go right back to 30 compressions again. 1 and 2 and 3 and 4 and 5. Keep doing this until you can take it safely to the vet, or someone else can come and take it to the vet if you don't have a 911 system that will take care of your pet.